Hello, everybody, and welcome to another episode of your dependablepartner.com Smooth Move podcast. We're very fortunate today to have Lisa Santiago with us here, who is a mover and shaker. She knows everybody, every meeting I go to, she knows everybody. And she is from Caring People Home Health Care. And I know we do a lot of home health care people. That's because there's a lot of them out there because there's a great need.
Mhm.
But each one has a specific um, bent that they use that might be different from others. And so it's always important to vet out what it is you personally need and whether or not that healthcare company suits those needs. So, Lisa, why don't you take it away and tell us a little bit about specifically your home healthcare company and what makes you special? What special thing do you have?
Well, first, Joelle and Brian, thank you for having me today. I really love doing these kinds of things because, as you mentioned, there are a lot of people out there who do similar things, but we all do things a little bit differently. And so, one of the things that I like in terms of our partnership is the continuation of care. So, as you try to help people downsize or move into either a smaller home or an assisted living or a senior living community, most of our goal is to help our clients very similarly in staying safe. It doesn't matter if they're in their home of 50 years or an assisted living. Sometimes people just need a little extra hands. So, to give you a little background, Caring People Home Care, we've been in business for 25 years. We've been in Florida for about 15 now, and we're in 6 other states besides Florida. So a lot of our clientele, like very similar to, I'm sure, a lot of yours, we get a lot of the snowbirds, the people who come for the season, or people who are retiring down here and no longer want the weather of the north or the northeast. So that's a little bit about the company being in business, and really from my standpoint, I've been in the senior care industry for about 15 years. Started in independent and assisted living and memory care communities, and I had 3 grandparents who had Alzheimer's. So a lot of what I do is resource based. I like to sit down with families and really understand what they're struggling with, because I'm sure, as you could probably attest to too in what you do, there's 7 different uh, decision makers. They all have an idea of what that perfect thing looks like, and it really is good to get an idea of what people are thinking before you can move forward, so that you understand their goals a little bit. So I use my personal experience in that initial discussion with the families.
I love that, Lisa. It's very much a social work model where you're meeting people where they are. And I love the whole term helping extra hands
Mhm.
because right before we started, guys, I was telling Lisa and Brian how my parents had a rough couple of weeks, and it was real hairy for me because I that's what I do. I take care of my parents, and I remember saying to them, like, I'm not your maid. You guys are not that disabled that you can't do a dish. Like, I need some help. I can't do this all by myself because also I'm running a business and I have my own life. So it's
Mhm.
interesting because it is that helping thing. And sometimes it's just something so small, like they can't run a vacuum, they can't do the dishes, they
Mhm.
can't maybe cook a meal for themselves, they can't get to the store. I mean, all of these things that we, as I guess I'll call ourselves able bodied people, don't think about because it's just second nature. I get in my car, I go to the store, I get what I need, and I do what I need to do. But when
Mhm.
you're not well and you don't have the type of energy that you had before, which of course as you get older, that energy just declines, then it becomes just harder to do the most simple things in life.
Mhm.
And I think that's where a lot of depression comes from for older people because you just can't, all the things you used to do, you can't do anymore. So talk a little bit more about, you talked about the continuum of care. And I also would love to hear a little bit about some of the other states that you're in, because I'm wondering, do you have people that are up north and they come down here for the South, and then you're providing that continuum of care for them with the same company?
Joel, that's a great point. We do a lot of that. So actually, right now we're starting to see our the beginning of our peak season, which I'm sure it's very similar in terms of your wave too. We have offices in New York, New Jersey, Connecticut, Boston, and then Texas.
What
And so
happened to
most of our
Maryland?
northerners are coming down now.
What happened to Maryland?
Right. That's where we both came from.
What are we, stepchildren?
No, I think maybe at some point they will, because we find a lot of where we are is where a lot of our clients go back and forth to.
Mhm.
Texas is kind of a little of an outlier, but everywhere up north, like Boston, New York, that whole New York tri-state area, we do a lot of circling back between giving care here in Florida and giving care up in that area too. So
I
it's
think
been
it's so
it's
beautiful, Lisa. That's so unique because,
Mhm.
you know, I'm going to tell you, my father-in-law passed away about 5 years ago, and he
sorry.
actually went for a ride in Boca Sunday morning to get bagels. He went from Boca West on Glades Road to the
Mhm.
bagel store, which is maybe a mile, and nobody could find him. And they put out a silver alert for him, and the
Mhm.
sheriffs picked him up in Bradenton. Okay, so he went all the way across the state, close to Tampa,
Wow.
and he did it in record time, which is even scarier. Like
Oh my
he did that
goodness.
trip in like an hour and 10 minutes, um, which means he was probably going 100 miles an hour. Anyway, my point in telling you this crazy story is, needless to say, we had to take the car away, right?
Mm.
And his children took the car away, and he was in his early 90s, clearly getting dementia. And we found a home health care company, might have even been yours, I don't remember from back then, but they found an aide to, it was a gentleman who stayed with him,
Mhm.
and they actually flew him back to Baltimore,
Oh wow.
staying with him in Baltimore, where he eventually, unfortunately, passed away in Baltimore. But
Mm.
it was nice to have that continuity, someone you
Mhm.
know, you like, you trust. And when you are in a state of uncertainty, and I believe the client is in a state of uncertainty too,
Mhm.
um,
Sure.
you know, that it's nice to have that familiar face. I'm not sure he knew where he was, if he was in Florida, Texas, or South America. I don't think he knew where he
Mhm.
was. But it
Yeah.
didn't matter because he knew the guy's name and he remembered that, and the guy helped him literally with all sorts of driving him places, making sure his medicine was taking, bathing, just your normal everyday
Mhm.
activity. So to hear you say that, Lisa, it just brought back a flash in my head. That's beautiful and so, so
Thank you.
important.
It
Yeah.
sure is.
Oh, I
Go
was
ahead.
going to just
Sorry, go ahead.
say that, a lot of times people are concerned about, having different caregivers and people stepping in. And I think just going to Brian's point about continuity is we're an agency, we're not a registry. So even if one of our caregivers gets sick, we have backup plans for that. We have other people we could have step in, and it's almost like a continuation of the person that they're with anyway, because we put a lot into a care plan and all the documentation for that, because I'm sure I mean, with caregivers, they're human too. Car breaks down on the side of the road, kid gets sick, you get sick as a caregiver. So to be able to also continue to help the families, so they don't have to worry about staffing in their own home, and still getting that continuation of care. And now we're doing it from north to south as well, so that makes a big difference for a lot of the families.
Now, you
Absolutely.
just mentioned something that I'm not sure anybody on our podcast has mentioned before. You said a registry versus a what?
So we're an agency versus a registry.
Explain
So,
what the difference between those two are, because I don't think people know those terms.
okay, I'd be happy to. With an agency, the caregivers work directly for us. They are employees of Caring People. They're W-2 employees. They have benefits like paid time off and holiday pay and liability insurance, like all the things that you would get as an employee. With a registry, the caregivers tend to be W-9 employees, so they're not directly
Accountable.
employed by the company.
They're
And so a lot
contracted.
of times with the registries, the way it works is the caregiver works directly for the family. So the family still has to make sure they have the payroll done. And if, God forbid, something happens to that caregiver where they're sick, the family is responsible for fill-ins and things like that, or finding a backup plan.
That's a nightmare,
Now,
Lisa. I
don't
gotta
get me
tell you.
wrong, a lot of those registries, the caregivers themselves have backup plans, like they have a cousin or a mother or somebody else that they know that could step in for them. But it's really more streamlined with an agency, I find.
I'm
Sure,
gonna tell
we're
you,
not trying to
I'm gonna
make
tell
a
you from
distinction that one is better than the other. I just didn't know. I never heard those terms, and I
I'm
think
gonna
other people haven't.
Joel, I'm gonna jump in and tell you from personal experience.
Sure, go ahead.
The registry, and again, I'm speaking from my personal experience, disaster. It was an unabashed disaster. I tried it for my father, and first of all, when you're doing registry, it's luck of the draw, okay, in terms of a vetting process. Um, Sometimes you win and sometimes you don't win.
Mm,
I had them at the very last minute many times say, "Oh, I'm sorry, we can't make it," and somebody needed to be with him overnight.
mm-hmm,
They had
mm-hmm,
to be with him during the day too, but during the day I could handle it. Overnight was a little bit more challenging, and they're supposed to start a shift at 5, and you get a call at 4:58. Sorry, can't make it today. Really? You know, unless you're prepared to become your own agency, I would strongly advise you against it because talk about lack of continuity. For me,
mm,
it was nightmarish. It really was. I needed to know that I could pick up a phone, speak with someone, and also be able to have a professional distinguish the levels of care that I needed. I wasn't able to do that,
mm-hmm.
right? But you're able to do
Yeah.
that, Lisa.
Brian, I think
Yeah.
that's a very salient point because
Thanks, Paul.
again, I'm only going from personal experience. I'm dealing with my parents and I dealt with both of my grandmothers. One was, it's odd now that I'm thinking about it, because the one that was more easygoing in general was harder when it came to getting help. And the one who was more difficult in general was easier to agree to getting help. But I notice that as some people decline, they don't want to admit they're declining, which I completely
Mm,
understand. But then they're not agreeable to care because they don't think they need it. So, like a perfect example is my mother and I have been on my father for I don't even know how long. He needs to use a cane, he needs to use a walker, refusing
mm,
to do either one. He's fallen more times than I can count. We were building a room in my house. I almost said to him, "Don't dare go in that room," because I knew he was going to fall. And I don't
mm,
know, must have gotten distracted. I didn't say it. We're sitting in the living room. All of a sudden, we hear this big crash. Yep, he walked into the room, didn't realize there was a step, fell, broke his foot. But since
mm,
he broke his foot, he's had to use the walker. Now he's out of the boot and he's still using the walker, but we never would have gotten him to use it otherwise. So I think, Brian, you're bringing up a very salient point about what people need. And I think when you hear it coming from a nurse, a caregiver, somebody that's their profession, you know what I
mm,
mean? Not like my child who's telling me that I need to do this, my adult child,
mm-hmm.
that maybe they receive it in a better way and are more agreeable to doing it. And
Right.
that's a real important part about what you do.
And I just want to go back and say, I don't, again, we're an agency, not a registry, but that doesn't mean that a lot of people don't use registries. I think sometimes people look at them, especially if there's a cost differentiation, because they tend to be less expensive.
Mhm.
And I have referred clients out to registries when they were really set on a certain dollar amount or limited in their finances. So, I work with a couple of different agencies that tend to be a little less because we do all levels of care, like Joelle was mentioning. We can do companionship, we can do skilled care at home. So RNs, case management, if somebody has real complex needs. Case managers, I don't know if everybody knows that term too, or care management is when we take over the responsibilities of, let's say, an adult child, like taking a client to the doctors because they have 10 different appointments and it's a lot of complex diagnoses, and the person may not be able to follow all of those things or understand what their medications are. So somebody who goes along with them on their appointments and can really delineate what's going on for them. And maybe the adult children just aren't local, so they need somebody here who's going to be eyes and ears for them and go with them. So we do a lot of that as well. And then the other thing I'd like to, point out is that we don't have a minimum of care. So even if somebody just needs, we recently had somebody who just needed stockings put on in the morning or whatever it was, and we can go in and do 1 hour of care in the morning, 1 hour of care in the evening. Transportation is a big thing for us because, as you know, Brian, you were just mentioning your grandfather didn't drive, and sometimes people just need to go to the doctor or go shopping or things like that, and they want to get out of the house. So they have somebody who's trained to be able to make sure they're still safe, but can then take them out and do the things that they still like to do or need to do.
One of the things that you said that I think is so important, and I've seen it, for those of you that don't know, a lot of us in this industry, we do a lot of networking with other people that are in the industry so that we can help one another. And I mentioned in the beginning that there are a lot of home health care companies, and that's because there are a lot of people in need. And what I've noticed when I go to a lot of them, people are always making jokes because you get up and you say who you are and where you're from, and they're like half the room is home health care. But the truth is that they work together. And Lisa, you just brought that up, and I think that it's so beautiful and lovely that everybody works together. And your real goal is not just getting business. Of course, you need business to survive, but your goal is to do what is best for the client. And you really highlighted that in what you said, that sometimes you refer out to these other companies that are not agencies because it's more cost efficient for some people, and not everybody has the funds to get the services that they need. So you're doing what's best by the person and what they need, and getting them those services any way that you can, even if it's not with your own company. And I think that is just speaks volumes about you personally and about the industry.
Thank you, Joelle. I mean, I'm sure you've been doing this long enough too, where you see people, they come to you with a problem, and sometimes as you dig through that problem, the problem isn't really the problem. There's like 17 other layers to it. So, I make a joke that sometimes I talk myself out of jobs because as I'm going deeper into it with people, they maybe home care isn't the right thing for them. Maybe they really are missing that social piece and they need an assisted living because they need more 24-hour care. And 24-hour care in a residential environment like an assisted living is still a lot less expensive than being home with 24-hour care. So, I've been fortunate enough to make friends with people like you, and help people along their journey. So even if somebody just needs temporary assistance, like recently I had somebody who, unfortunately, the wife was taking care of the husband. There were no local family here. The children were up north. And whenever she couldn't handle her husband, who had dementia, she would call 911 and send him to the emergency room. And that's also very traumatic for somebody with dementia. So we were able to at least put temporary care in place until they could get into a long-term care situation with a memory care community. So it was, I think we ended up doing maybe 4 or 5 days worth of service, but at least we were able to help him get out of the emergency room and the hospital, get him into an environment that's more suitable, and still keep him safe in the interim, because she just really was so ill-equipped to take care of him by herself.
I gotta tell you, I mean, it's hard. It's
Mhm,
way harder than I ever imagined. Because, as a adult child, you see your parents, like they would come and visit me in Maryland, they would stay for 2 weeks. I didn't really I saw some things, but I thought it was my dad's hearing. It didn't really seem so bad to me until I started living with them, and then I was like, "Oh, whoa, there's some real problems here." Like, can't connect dots of simple things, like, just some real differences in behavior that I hadn't noticed before,
mhm,
and I'm a social worker. I worked at Johns Hopkins, I've worked with a lot of different populations, and you would think for somebody with that background that it's not as hard to deal with, but they're my parents, so you've got the emotional piece to it, and it's hard. And when I talk to my siblings, like one of them I think is in denial. They keep saying, "Well, they're just getting old." And so I
mhm,
finally said to them, "Well, if it, God forbid it were your husband or your child that was having problems, would you just say that's just the way it is, or would you try to do something?" She's like, "No, no, I would try to do something." I go, "Okay, okay. I'm not just gonna let them decline and not see if we could stop it, if we could get assistance, if we could, whatever it is we could do." And the group of people that we network with and that are in the senior arena have been so incredibly helpful to me. Um,
mhm.
but it is difficult. And I could not imagine if it were just my mother and my father.
Yeah.
There's no way. There's just no way. There's no way. See, it's a very challenging thing to take care of somebody, whether it be physical or mental health decline. It's
Mhm.
just a very difficult thing to manage. So having people like you out there that's going to do right by the person and get them what they need, regardless of if it's your company or somebody else's, is just an incredible thing. Now, do you take all insurance? Is it private pay? Do you take long-term care policies?
So we are a private pay company, so mostly out of pocket expense. However, we can help our clients if they have a long-term care plan. I've sat with, 90-year-old women trying to open their policy with the companies on the phone because they just don't know what to ask for, where to start.
Right.
Talking about all the different things that go into long-term care plans.
Mhm.
We also have a partnership with Vet Assist, which can help our clients get pre-qualified for the aid and attendance benefit and actually start benefits if they have all their paperwork in order, could start as early as a month after. So we, sometimes when people are doing that themselves, it can be daunting because I'm sure with the veterans programs, the paperwork itself and the delay in getting benefits can be overwhelming for
Well,
clients.
mhm.
So we do try to help them with that. Um, and then, really, anytime I can partner with any Medicare agencies, we can also support by having the Medicare companies come in their hours and we can kind of work around that. There's a lot of different ways to try and help and assist without us all stepping on each other's toes.
Well, it's important that you said that because when people hear private pay, I think they think I don't have the money, so I can't get any help from this person. But that's not true because there are some resources that you might be able to tap into for them.
Mhm,
Lisa, I'm
absolutely.
going to just tell you, I got veterans benefit aid and assistance from my mom very late in the game.
Mm,
And because I didn't know about it, nobody told me about it. I discovered it by accident, where for 10 years I could have been getting it. But I couldn't get them to stop sending me aid and attendance after she died. They were
wow.
sending it to me for well over a year. Even though I sent in a death certificate, requested it stopped, tore up the checks and sent it back to St. Louis, it was a hot mess. But
Wow.
in any case, so give us, for our listeners and subscribers, if they are in need of your services or want to get in touch with you or want to inquire about maybe um, using your services personally or for a family member, how do they reach you?
So we have three offices in Southeast Florida. Again, I know some of your reach might be a little bit further north too. But they can always go on our website and see our locations, which is www.caringpeople.com. I always give out my cell phone number as well. My number is 954-901-1694. And, even if I'm not, most people will think I work, a 9 to 5 job, but even if I'm not working, I have a team of people behind me and they always will get messages, and help people at any time. We have somebody on call really from 6 in the morning till 11 at night and on weekends.
Wow.
We also have a service overnight, but where you get a live person who knows us, knows our community very well, knows our company very well. You really have them during the majority of the day.
That's
I'm
fantastic.
so thrilled that you were with us, honestly. I learned and I enjoyed, and those are two really good criteria. So the number one more time, 954. Your number, Lisa,
Oh,
one more time.
yes, I'm
954.
sorry. 954-901-1694. I thought you had already memorized it, Brian.
I did, but it's not for me, it's for everybody listening. So, Joelle, you want to take us out?
Sure. So, if you like what you hear, please subscribe. That helps us grow our audience. And if you have any ideas of people you'd like to hear on our podcast, please let us know. And we're always here to help you with your smooth move. As you know, we focus on people that are moving to independent, assisted, or memory care, but we could help anybody. We will downsize you, take care of auctioning things off, selling things, getting rid of things, and helping you get into your new place so that when you get there, your bed is made and you're ready to move in. And thank you for being our guest, Lisa. We really appreciate it.
All
Thank
right.
you so
Thank
much
you.
for having me.